Welcome to the first session. I'm Shakila Tangaratina. I'm Vice President International of the Academy of Medical Sciences. The Academy of Medical Sciences in UK is an independent expert voice of biomedical and healthcare research. And we support researchers with funding, career development opportunities, provide a sustainable environment for research, and also liaise with policymakers, industry, academia, and healthcare teams in promoting research. We also work with many of our sister academies, and today in this session, we are here to share one such work. So this is a joint work with the US National Academy of Medicine, and it is called For People, for Planet, Environmentally Sustainable Healthcare Research. Today, we would like to make it an interactive session as much as possible. We'll start with an introduction about the background to how this report came into being. We'll briefly share the findings of the report and discuss with the panel their views and opinions. And then we will open it up for interaction with the audience. We have the next 90 minutes to do this, and hopefully we will be able to provide as much detail and a flavor of what we have done and make plans on how do we move forward from here. So before we start, I would like to know a bit more about the audience. Could you put your hands up just to know where you're from? If you're from Europe, please. Well, thank you. North America? Thank you. South America? Excellent. The Middle East? Africa? Excellent. Asia? Excellent. Australia, New Zealand, if you guys haven't. Excellent. And hopefully I've covered all the content. The next one is, have any of you been working or have worked in the health sector? Can you put your hands up, please? And could you keep your hands up if you're also involved in health research? Excellent. So we do have a multi-sector beyond health with us today. It's good to always know your audience. So moving on to the background of the project. It's my great pleasure first to invite Chris Hanley, who is the Director of Grand Challenge on Climate Change and Human Health at the National Academy of Medicine in the US. So Chris will give you a brief background about the project.
Thank you. Good morning, everyone. My name is Chris Hanley, and I come to you from the U.S., where I serve at the National Academy of Medicine as the director of our Grand Challenge on Climate Change and Human Health. I wanted to start by thanking you all for joining us this morning. Thank you for having me. Thanks to our friends at IAP. Looking forward to the next couple of days, and hopefully we're starting this off quite well for you all. So before I turn this over to our panelists, I want to take a quick sec and talk to you about the program itself and how it came to be, because this is something that has been incredibly valuable for us in the U.S. I don't want to speak for my friends and colleagues in the UK, but my guess is they wouldn't have invited me up here the same. So really want to share with you about how this report came to be, and then we'll talk about how it turned out in a second. So I'll rewind a little bit. About 4 years ago, when the Academy presidents for our organizations came together and decided that we wanted to work together, not necessarily knowing how we wanted to do it, just that we wanted to do it. So it's been informally ideating, emailing back and forth, and then very formally ideating at a workshop to where we came to the conclusion about the general parameters of how we wanted to work together. And first of all, take a step back as we're thinking, do that one of the partnership. So before choosing a topic or how we wanted to go about developing together, we knew that whatever we wanted to develop had to be sustainable. We couldn't just be choosing a topic and then burning everyone out so that we never wanted to see each other again once we were done. We really had to take some time and think about, all of how we could interact together and then behave accordingly. So after thinking about that, we thought about, okay, how are we going to go about actually working together and thinking about the best way to do that is really just get the game. So we decided on a program, decided we needed to pick a topic for that program. And at about that time, the thinking about climate health, that's what that helped. So we explored that being the topic, found a lot of people were very interested in it. And again, we didn't want to really focus too much on the topic because we knew that our academies was the first step, and that really we just wanted to bring some incredible people together. Bring our academy, what makes them such unique entities within the world, really focused in on. And I cannot state this enough, that these people are experts in their field, but they're not just experts in their field. They are really individuals who bring them together and find the top of it. Yeah, they will become experts in whatever field they want very quickly. They have the ability to take that expertise and apply that to the field that they actually are experts in. Finding health really be an underlying topic that can flow throughout the expertise. And so that's what we decided on. And we set the call out and had about 20 fellows who agreed to come join us. And once they did, we gave them 3 objectives as a So I'll tell you those 3 objectives. And then the 3 objectives we had for the group were that they were to come in and see career development, gained experience of translating research into policy recommendations, expertise, and build climate health. This is the most important step. That we wanted these individuals to come in and build relationships. This was not just an exercise for us to improve the relationship with us and partners. We wanted many of these fellows and members, several of them were early in their career. And then lastly, we didn't want to dictate to these individuals. We did give them the parameters, sessions, developing. So that's it for me. Yeah, these steps.
Using for today. It's my great pleasure to have Dr. Ying Go, who is the U.S. co-chair of the report. Ying is the former public health director of City of Pasadena and a former senior policy advisor to the vice president's office previously. Joined with Dr. Julia Wilson, Julia is the Director of Strategy, Partnerships and Innovation at Wellcome Science Institute, and who brings together academia industry engagement. So we have 2 individuals from different health systems with very different backgrounds coming together, sharing this report. And we also have with us Dr. Jenny Rivers, who's the Director of Research and Development at Barts Health NHS Trust, one of the largest trusts in Europe. And she also manages Barts' Biomedical Research Center, its clinical research networks and clinical research facilities, bringing a wide range of experience in delivering healthcare research in the clinical setting. She also brings experience of working at Great Ormond Street Hospital, as well as a higher education institution like University of Liverpool. And finally, she's joined by Dr. Tony Yang, who is an endowed professor with tenure and associate dean at George Washington University. He's the program lead for George Washington's Cancer Center for Cancer Control and Equity. And he works at the research intersection of law and policy and healthcare delivery and population health outcomes. So we have a fantastic panel with us today, and these are 4 amongst the 16 who contributed to the report. So first, I would like to invite Ian and Julia to present briefly the findings of the report, and then we can open up for panel discussion.
Thank you so much, Shakila. It's really a pleasure to be here. So I want to thank the academies both for the opportunity to be here, but also the distinct honor and privilege to be a co-chair of this group. I'd like to describe the project goals. You heard a little bit from Chris. We really were focused on building a multinational professional network among a group of next generation research leaders. I have to say, though, that they were largely also very established as leaders in their fields already. We also were focused on providing career development for the participants. We wanted to deepen their exposure to the issues in climate and health, and also to increase their experience on making science-based policy recommendations. And then that culminated in the final report, which you'll hear about, that provided both a landscape review and some policy recommendations in the form of a report. We did want to share the names of the members of the group. There's 16 of us in all. And as you can see in this slide and the next slide, that there is representation from across the UK, different types of institutions from across the US, and also participants from Hong Kong as well. And with representation from clinicians as well as scientists and researchers. And so I hope this photo can communicate the energy, enthusiasm, and really the spirit of the group. We really enjoyed getting to know each other. Here we are posing with the Albert Einstein statue on the grounds of the U.S. National Academy of Medicine. And the programs you can see on the slide are represented. We have individuals represented from these programs from both the UK Young Academy, from the AMS programs listed there, and also the National Academy of Medicine, Emerging Leaders in Health and Medicine. So a little bit about the process. I think we're missing some portion of the slide, but that's okay. So we started, as you heard from Chris, we started gathering in person to really build those connections. And we had a charge, but we didn't have a topic of focus quite yet. We were allowed to have about 6 months to get to know each other and to discuss and explore to determine what that topic would be that we would ultimately focus on. And so once we chose the topic, we decided that we would be looking at the sustainability of health research and how to make health research more sustainable. And we divided our groups into work groups to focus on those topics with 6 themes that Julia will talk about a little bit more. We then had time to conduct an extensive literature search and resource reviews. We had the benefit of consulting with experts, mainly from the UK and the US, who really provided us with a lot of the content and direction that we needed to put together a report. And we had a lot of personal experience to draw upon from the individual participants in the group. We then spent time drafting and reviewing and editing and re-editing the document itself and using the evidence and resources that we found. And then we worked with our copy editor and finalized the report. And it's in September. We are very pleased to be able to announce and disseminate the report. We are currently engaging in this kind of policy engagement and trying to make sure that there is visibility in sharing the results of our report. Oh, here we go. The rest of the topics I did cover. And that's the cover of our report. So just to highlight a couple aspects of the process, it was because of the diversity in geography, the process was a combination of in-person and hybrid. We felt that that component was certainly critical of to build those connections, to meet each other and get to know each other. So we had 2 convenings in person in May of 2024 in London, and then in December in Washington, D.C. And so the project duration was about a year and a half. We conducted formal work when we got together, but we also had time for educational opportunities and also social networking. And so there was, for example, an event at the National Academy of Sciences where there was music, food, and really interesting TED Talks. And it was actually a public engagement event where we got to also participate. So that was a really nice addition to our activities. And then for the virtual collaboration, of course, working across continents and time zones was a challenge. We had found finally a sweet spot with a meeting time where it was early morning for some, afternoon for some, and late night, midnight or 1 a.m. for others. But that was a nice way that we could get together and actually conduct some of our work. And so finally, this is our report, and there is a QR code where you can find the report itself for People for Planet. Just to highlight 2 aspects of this, that we did find that there is limited data that exists about the sustainability of health research, and that there really are opportunities for more sustainable practices across health research. So we're going to delve into a little bit of that next by highlighting our themes.
Thank you, Ying. I'm going to take a deeper dive into some of the thematic areas where we gathered evidence to inform the policy recommendations at the end of the report. Our first theme was data, metrics, and information availability. And we found that there's actually very limited evidence, or limited abilities, limited methodologies to quantify the environmental impact of health research. There is some evidence, there's some calculators where one can measure carbon footprinting or greenhouse gas emissions, but very little that looks at the entire health research ecosystem. So there's limitations on what we can gather and document currently. And we know that the quantification of emissions is really important, increasingly as we're all using AI and machine learning to analyze research. And that impact of computational aspects is also something we need to be able to quantify, measure, monitor, and ultimately reduce. And we know that the global health sector lacks those standardized methodologies to assess, monitor, and ultimately reduce emissions in research. Our second theme was funding, and where we see that funders hold a critical role in driving progress in this space. Health researchers, health funders can include the requirement for environmental sustainability in their applications. They can also open new funding streams to enable us to address gaps in this research. And we found in the UK that a number of health research funders have come together to start to issue position statements on environmental sustainability in health research, and also to start to request information about the sustainability of health research in funding applications. And we feel that health research funders need to work together to collectively come up with a minimum standards and requirements for what researchers and research organizations should be doing in this space, and providing that information, but also providing funding to enable this to happen. Our third theme was regulation, and where we see regulation and the regulatory environment will be able to help increase the sustainability of health research, but not impact on the integrity of the science, the safety of the science, or the ethics of the science. We also think regulators can incentivize this sector through providing certification and accreditation, so we can all be working towards the same standards. And again, we realize that collaboration between key stakeholders in this field, that's health researchers, funders and regulators and industry, will make an impact in this area. Our fourth theme was procurement and supply chain, where we know that best practices in this area will be able to reduce the environmental impact of health research. We're also aware that health research is a large emitter of greenhouse gases and has an impact on environmental sustainability. So through supply chain and procurement, we can create greater efficiency and reduce our impact on the environment. We're obviously aware, because of the global nature of procurement and supply chain, this is quite difficult to assess and monitor. We realise that there's global barriers, financial barriers to doing this, and sometimes there's a lack of transparency in supply chains. So we do realise that this is a challenge. But again, we see cross-sector alignment could enable this to happen. We can align policy with funder regulations, institutional regulations to ensure our supply chain and procurement is minimising the effect on the environment. We also looked at infrastructure, so the physical space with which we deliver this health research. And we know that improving the environmental sustainability of our physical research environment, again, will reduce our impact on the planet. This can be done throughout the research life cycle, but also starting with the buildings that we work in and having net zero buildings, either from new buildings or improving the facilities that we currently work within. We're increasingly realizing in this digital landscape of computation and AI, machine learning, meeting health research, that we need to improve our infrastructure on data management and high performance compute and the effect on the environment there. Our final theme was capacity building, both of individual researchers, but also research institutions. And our analysis of the evidence found that there's currently no widely accepted or standardized methodology for training scientists or organizations in this field. We need to be able to assess, monitor, and reduce our impact on the environment. There have been some UK funders, a range of UK funders have come together to collate and share their training materials in a central resource for researchers and institutions to use. So there are elements of good practice that we've found. We also see that we need to be training young researchers from as early as undergraduates on environmental sustainability of health research. But we also need to be training at all levels and all parts of the sector. And that includes upskilling the current workforce and engaging with research organisations to upskill the administrative teams as well. Again, we see that collaboration is key to delivering this, the collation and sharing of best practices, and sharing of resources and standardizing those resources so that we're all working to a similar level and a similar understanding of the terminologies and the assessments and the monitorings. So after many months of gathering the evidence, speaking to experts and collating all of the information, sometimes finding that there's a real gap in the information that we could gather, we came up with four major policy recommendations in the report. The first is that we need to adopt and refine shared metrics, tools and methodologies. And this This is so we're all working to that same standard and same level of understanding of these terms. So we're using comparable ways to assess and report. Our second recommendation is that we will need to embed these sustainability requirements incrementally. We realize that we're going to need funder and regulator and publication processes to evolve. And at the same time, we'll need to be pairing these with guidance produced for researchers, but also financial support if we're asking for additional reporting, additional assessments in funding applications. Our third policy recommendation is that we need to invest both in people and in infrastructure. We need to prioritize training for scientists and research organizations. We need to create accreditation schemes and green facilities that can be used across diverse research settings. And finally, our fourth recommendation that came through extremely strongly during this process is that we need to foster international collaboration and data sharing. We know that climate change knows no borders, and the solutions will need to be global and worked with the entire research community coming together to make a change in this area. As we've touched on, this was a group of academics from the UK, US, and Hong Kong, some of them quite early career researchers as well. And it was used as a training ground to upskill expert scientists, but in understanding how to synthesize evidence and move those into policy recommendations. And we've got a number of personal reflections from the group coming up. Obviously, some individuals on this working group, they found it really made them think about their own research and how they could reduce the environmental burden of their own research. But at the same time, there was also that realization that a topic such as the environmental sustainability of health research can only be tackled by bringing together groups with different experience, different lived experience, different scientific experiences, and coming together and approaching the same problem, but from different angles. And that co-creating the report was a great learning experience for some of these researchers to think about how one can take their science and gather evidence and then start to establish and move into policy recommendations. There were challenges of working internationally. As Ying mentioned, the time zones were a challenge to sometimes have a meeting in the middle of the night. But I think that the thought that we're working on this project and it was truly international, and the fact that it was going to be applicable beyond the US, UK, was a real motivational factor. Obviously, during these 2 years, there's been many geopolitical changes globally. And I think that was a real training bed for this group to understand how policy recommendations can be shaped, adapted, and reiterated in real time in order to influence the change that one wants to see. When the report came out in September, Ying and I, as co-chairs, were active on social media, often having bite-sized chunks of the report, pushing them out through various social media channels. I think in the hope that we could reach slightly different audiences adjacent to climate and health research, audiences adjacent to health research, and reach academics, clinicians, those that work in industry, and policymakers. And we do have to acknowledge the two academies, the National Academy of Medicine, the Academy of Medical Sciences, and their presidents, who were enormously supportive and enabled this project to happen. We were also privileged to have two fellows from both academies, so Melissa Simon and Paula Williamson, who were experts in the field of translating science into policy and supported the group alongside Ying and I as we developed this report. We've also got to thank the academy leadership teams in the academies who provided that framework for us to work within and the deadlines for us to work towards. But they were also incredibly generous at opening up their networks to experts in the US, UK, and beyond. And those series of experts were interviewed and helped shape some of our thinking in this report, and which we're incredibly grateful for. So now we would like to go into a discussion session with myself and Ying's co-chairs, Jenny Rivers and Tony Young, as participants, so we can learn more about the process and the experience and the recommendations that we've got from this session. So thank you very much.
Thank you very much, Ying and Julia, for giving the background of the project and the summary. So moving on to the discussion. Tony, if I may start with you. This group brought together individuals from two different academic settings, from biomedical research all the way to implementation research. Just want to know your views on how such an interdisciplinary group engaged and influenced the project itself.
Thank you. The mix of people around the virtual and twice in-person table really shaped everything we did. We have lab scientists, clinicians, data AI folks, and public health and policy people, and others. So every idea had to make sense, not just in series, but also in lab, clinic, server rooms, and ministry or public health department building. We quickly learned that just make it greener isn't a strategy, because the different perspective, we were pushed to ask, what does work for a smaller institution, for overstretched clinicians, and for people outside major city, for community already carry gray climate and health burdens. That made the our final recommendation much more realistic and more attentive to equity from the start.
Thanks, Tony. Jenny, I would like your thoughts on how you felt working between the two academies, because it's a very close work between two academies for this project. But also the officers and others who helped you with this. I just want to know your experience of how you felt being part of this.
Thanks, Shakila. Yeah, I think that was absolutely vital, really, to the success of this project. Was really considering the context across the UK and US from the start. I think for us, we had the passion and motivation of the research leaders, but also then the core missions of two different academies to work to, which really gave us that framework and support. And I think without their expert guidance and advice on policy making, which was quite new to a lot of us, and certainly took us quite far out of the day job. My day-to-day is mostly running clinical trials in a hospital setting. So this was a real opportunity to not only step out and look at the policy context and the landscape, but to do that across international borders too. And I think it's a real opportunity for us to create a model for change, for international collaboration, rather than considering something in one context and trying to then apply it to others. And I think really important is that sustainable partnership and collaboration that we've now formed as a result of the project. I think we signed up to something that
that sort of seemed initially as a time-bound 12-month project, and that was sort of spring 2024, and here we are in at the end of 2025, very much still going strong, and we've had opportunities to publish across international collaborations, to attend events, and to do various other things that I think really maintains the core mission of that partnership.
Thanks, Jenny. And Chris, it'll be good to have your views as a staff of the Academy on how you felt things that did go really well and the challenges that you face, more as a learning for the future as well.
Yeah. So I know I'm speaking to an audience who does a lot of this work, a lot of multinational work, and obviously at the Academy of Medicine in the US, we do a ton, but this was different from us in that it was like a true partnership and just two organizations and in some ways that was a lot more challenging in these big multinational groups that we bring together. But I will say that the effort that we put in, we were rewarded exponentially. And I think when I think back to this and think back to this last year, it's obviously been a very challenging time in the US if you're working in climate health. We lost all partners from our 5 main federal partners, all of them, pretty much gone within the matter of a month. And to have those relationships with another organization so strongly already embedded at the time when this was happening was incredibly valuable. And I've heard the stories from the members and fellows as well that in the US specifically, when we're going through this turbulent time, that people were reaching out and not just as colleagues, but as friends, and found that to be incredibly, incredibly valuable and something that was very unexpected. Because we did have a smattering of that, at least for us, in these big multinational working groups that we did develop. But there was something really special about this, like true partnership that took a lot of work that was just incredibly fruitful.
Thanks, Chris. Ying, why do you think it is important to bring together science, research, and policy in this space? And how did the group feel that it actually benefited them?
I think we cannot overstate how great of a need there is today to inform policy with science. And where we are, where that is at risk, I think activities such as this, putting out, publishing, and disseminating information that is science informed and making those policy recommendations, so bridging that gap and training these leaders to be able to do that as they continue in their careers. I think that has been, it's just so important.
You want to add to that, Julia?
Yes, I can build on that. Thanks, Sheila. As Ying said, I think it's really important to have evidence-based policy making. And to do that, we do need to upskill some of our scientists and clinicians and give them confidence to be credible in policymaking setting as well as in the scientific setting. And we increasingly need leaders in health research who can work across traditional boundaries, either from science into healthcare or healthcare into policy or healthcare into industry, and understand the drivers and motivations of the different players in the sector. And also to the training that Ying mentioned, that we need to train those to distill information and provide recommendations and solutions that can be easily uptaken by policymakers. It's probably not good enough just to do amazing science. You need to provide a roadmap into policy increasingly now.
Thanks, Julia. So moving on to some of the findings of the report. Jenny, the report mentions that one of the key recommendations is to embed sustainability in funding in terms of the regulators as well as publications. It'd be good to know your thoughts on how can this be done in a real world scenario in an equitable manner, and what are the risks that healthcare research could be affected in trying to do all of these additional recommendations embedded there.
Yeah, thank you. So it was really important from the report that it's a real coordinated effort that's required to make change here. And we spent an awful lot of time thinking about any unintended consequences of any recommendations that we made, and particularly thinking about that global health equity was one of our core values. And we all felt very strongly that whilst we were looking in a UK-US context, we needed things that were going to translate beyond that into a global setting. So, and we'll talk a little bit about next steps later on. But what was also really important, that was whatever we recommended, we needed to maintain quality for research. And we recognize that research is a contributor and has a substantial environmental footprint itself. And so we needed to really embed that equity piece in terms of how we continue to support high quality research that's going to have an impact, but also to try to reduce the environmental impact of that and really keep the sort of health crisis element at the heart of everything that we do. And so, yeah, keen to talk about how we might do that. I think there's more that we need to do to make sure that happens. Thank you.
Thank you. Being one of the other recommendations is to invest in people and infrastructure, given the resource constraints that many of us, almost all of us face. This would be good to have your views on who has to make the investment, how and when in this space.
So one of the findings from the report and from this work were that the investments that the group thought would be the highest yield included in training, in infrastructure, I think physical and otherwise, and also in so the green facilities, and also in a best practice that they identified, which is accreditation schemes. So the My Green Labs and other schemes that are there available for institutions to utilize to make the health research more sustainable, that is an area of investment. And so then the question is, who should be doing the investing? And I think, of course, as usual, the answer is everyone. So at all levels. I think in the US, because of current events, we saw a reduction in investment by the government, whereas the UK is still going strong and really being a leader in governmental investment. But to remember that policy doesn't happen is not just governmental policy, but certainly academic institutions have policy at different levels. Even individual researchers within their labs or their operations can develop policies that support more sustainable research. So at all levels, there is room and opportunity for investment.
And Julia, do you want to share any of the initiatives in the UK sector from the funders that they have prioritized?
Yes, thanks, Sheila. We did find some best practice in some of the UK funders of health research, both the government funder, UKRI, but also some of the philanthropic funders, Wellcome and Cancer Research UK, who are currently addressing the issue collectively and providing guidance on what they themselves do as funders and how they commit to tackling the climate crisis, but also extending that out into working together to collectively provide recommendations for funding applicants and for the institutions that they fund. So that ranges from starting to include a minimal set of requirements in research applications, addressing this, and ensuring that perhaps we're all using the same type of calculator to assess the environmental impact of our work. From collating into a central repository information and guidance on how individual researchers, individual laboratories, research organizations can start to do this. Funders also realize that this can't just be another requirement that's passed on to the recipients of funding or the organizations that receive this funding. So they're also working on how as a sector group of funders, they can also invest in this area to promote more environmentally sustainable health research. However, there's also a recommendation, a recognition that this needs to be done incrementally. We can't just suddenly create a new set of strong standards overnight. There'll need to be an incremental increase in including this information in funding applications and how funding applications are assessed and monitored at the end. And just so we can all move together collectively and not create an inequitable environment for research to happen.
Thanks, Julia. And one of the many things I loved about this report is the clarity of thought process as well as the presentation. For example, you made a recommendation, but then you also thought deep about the unintended consequences because of it, and how you can mitigate. And it's a lot of thinking, okay, it's not enough to make a recommendation. We are aware that it's going to have a snowball effect and other things to be aware of. Tony, maybe you could help summarize some of these unintended consequences and some of the mitigations that you've suggested in this report.
Thank you. Great questions. Our biggest worry was that if we're not careful, sustainability requirement could unintentionally deepen existing inequity. So, for example, a well-manned rules might be easy for large, well-funded, well-established institutions to meet, but much harder for smaller institutions or safety net hospitals or partner in a low and middle income country, meaning that the green solution could potentially end up shrinking who gets to participate in research. To avoid that, as Julia mentioned, that we argue for flexibility and co-design, setting clear rules, but allow different paths to get there, face challenge changes in gradually, and monitor who is being helped and heard along the way. And we also emphasize that funders and regulators should not just say, do better, but provide funding tools, training, especially for undersourced setting. So greener research doesn't become a luxury that only already advantaged institution can afford.
Thanks, Tony. To move on to the two co-chairs, would like to have your views on what the findings mean to your respective health systems and healthcare research, given that you are operating at a slightly different baseline and the funders, the regulators are all respective health systems and healthcare research.
I think this report has been monitored widely in the UK. It aligns with our National Health Service commitment to reducing, to improving the sustainability of our applied healthcare in the UK. So it's very complementary to the upstream activities that then result into move into healthcare. In my own particular world of genomics, which is very resource intensive in computational, in AI, it is enabling us to consider the environmental impact of high performance computing and moving towards using green algorithms, redesigning our data centers. And I know it's also been taken up in this report is also being utilized in some of the government thinking about the building data centres in the UK as well. So I think the broad nature of this report is enabling us to reach different sectors and different players in the ecosystem and influencing change through a variety of ways.
I think the significance for the US includes that there is a lot of opportunity and that partnership and looking for other models and examples that are leading is a good first step, and that there are different players in the research universe in the US that may need to step up. The private sector needs to take a role, possibly a new leadership role in sustainable research. And really to remember that to look for the policy window so that there is a lot of work to be done now as we move through kind of a shifting environment in research funding, but that the work needs to continue to be done as sometimes our policy leaders and kind of approach and priorities shift and change.
Thank you. And Jenny, this is a question for you. So this is a report that was jointly done by 2 country academies. But I'm sure it has got implications beyond these 2 countries. So it'd be good to have your views on what are the global implications of this and how can we expand. We've made a start here with the 2 academies. How can we now expand into global engagement to other health systems, to other countries? It'd be good to have what you think about it.
Yes, thank you. I think that's really important. This is really just the start for us, and in terms of how we take that forward for the wider engagement. There's really there's a great opportunity, I think, now, because we heard about some of the government initiatives that those sorts of things are happening worldwide, and it's our opportunity to step into that space and work with partners to try to establish more of a global governance framework for some of this work. So particularly engaging with organizations like the World Health Organization. And recently we talked about this at the World Health Summit, where there's so many amazing examples of initiatives to reduce the impact of climate change. But this gives us an opportunity to bring some of those things together and look at models for engagement and how we might change that. But also it's really important for us in a global context to think about other sectors that drive some of this. And particularly we talk about health and we talk about delivery of healthcare and healthcare research. But we also know that the impact of transport or housing or some of these other big sectors need to play into this. And I think that's an opportunity for us to translate some of the recommendations that we've made in this report, not only into a global context, working in partnership with other organizations, but also to play that role within the sort of multi-sector policy landscape, which is something that we're really excited to take this forward into.
Tony, what are your views on expanding beyond US and UK?
Yeah, thank you. Because US and UK research are large emitters and setting so many informal or hidden rules along the way. And what we do in sustainability doesn't just stay within our borders. So if we get this right, we can help creating norms, tools, and supply chain that lower emissions and support partners in lower middle income country. If we got it wrong, then we risk exporting higher cost and setting new barriers for that potentially for the least able to absorb them. So looking ahead, we see several different next steps. First, we can share and refine our recommendation with research institution or community from lower middle income countries, and then co-design metrics, tools, and training with them. So they are adoptable, not just US, UK templates in disguise. And then third, we can potentially launch a few demonstration projects that to show that climate responsibility, scientific excellence, and global equity, they could be aligned together, and we can show that in real world settings.
Thanks, Tony. So the last question for the panelists before we open to the audience for questions is to Ian, Julia, and Chris. What next? What next, Ian and Julia, from the report and where you go from there? And Chris, what next to such partnerships and your plans?
So I think we heard some ideas from Jenny and Tony. We are leaning on our participants to continue to use their networks to disseminate the report and communicate its findings. Julia, do you?
So obviously I'll take the UK perspective on this, where I hopefully can have more influence. We've been leaning in on our parliamentarians with the findings of this report, giving it visibility in Parliament, pushing the recommendations, and also leaning into working with funders to incrementally uptake the recommendations in this report as well. I think on a personal level, I think Ying and I will remain friends for life now from working together, and there'll be many professional opportunities as well that have resulted from this international working group. We should be monitoring those those networks and outputs from the report that have come because of the introductions and the networks that we've built.
So I think for us, there's two parts to this. There's the known and the unknown. And the known parts that have been talked about are definitely the parts that you're all familiar with, which are the dissemination pieces for this, making sure that it's ingrained with our work. The program I run at NAM is our grand challenge, which is the most ambitious thing really that we've ever set to do on the program side. And this is going to become an ingrained part of this. We do have a research arm that we have as part of that program. It's one of 5 of our pillars. And it's going to be not just disseminating this in the normal way in terms of publication, which we've already been doing, but really making sure that it's ingrained within our work going forward. So any of our research work really looks at this as kind of a keystone piece of starting out for any project that we take on. I think for the unknown piece, and you've heard me say this, but I really, truly mean this, like this partnership has been absolutely invaluable to us. And I'm very excited to take it on or to take it steps further. And in a lot of ways, we've only really just kind of planned this first phase out. And I'm really excited to see how we rehuddle after this and figure out what we're going to do next, because that is the part that we do know is we're going to continue to work for in this partnership. And then I'm really looking forward to hearing from you all if this resonates with you as well, because we're looking to expand partnerships and expand the work that we do in kind of that one-on-one way, just because it has been such a successful pilot program, let's put it that way. So really, really looking forward to hearing your all's thoughts around just this project and partnerships in general in this manner.
Thanks, Chris. Now we'll open for discussion with the audience. It'd be good to hear from you if the kind of work that you're doing in the space, how you feel it resonates with you, opportunities, and also any questions that you may have for the panel. Okay. If you could also introduce yourself before asking the question, please.
So my name's Mark Warport and I'm from the Royal Society. So I like the methodology and the approach, but I think you slightly suffer from a common problem, which is we're talking at the end about policy push. The real challenge of reports is to have a policy customer. And this is where this is an extremely difficult area. And you've rightly identified some of the major issues in health research. So there's enormous energy costs from synchrotrons, from high-performance computing. There's resource costs, which are enormous, helium in relation to MRI, not to mention the energy costs. And no one's mentioned reusable plastics. So the health sector has some pretty major barriers to deal with. And I think my real challenge to you is this is a time when finding customers is increasingly difficult, I'm sorry to say. So governments around the world are pulling back. And so my question to you is, what engagement have you had with policymakers so far? And I point out that parliamentarians in the UK are one thing, but it's actually the government that makes the policy decision. And it is governments in general that are major the policymakers. And so I think you're going to have to come up with some pretty concrete recommendations. And actually, if you're going to make a difference, I think you have to start tackling the questions of detail of things like energy costs. And some of them, unless you have a green energy source, you can stop using light sources, but that would actually have a major negative impact on biomedical research.
Sure. So thank you for the comment and question. I think this is an interesting one for us in the U.S. I mean, first of all, so much of our policy is developed through private sources, and we have them to look into. And we talk about customers having them develop their co-partnership purchasing power is something that we really try and lean into. But I think for us in the National Academy of Medicine, we are at an interesting time that I want to choose my words carefully about in terms of people who come to us. I think there are a lot of challenges now, and I don't want to get into now too much. Maybe I'll leave it to my colleagues to say that, but I will say the thing that I am thinking about constantly is some advice that was given to me that says the world is not getting any cooler. Like the challenges that we're facing and the extreme weather events that we know are on our doorstep, they're going to bring a lot of those customers to us. And we saw that in the US about 4 years ago with a different administration. And I do think that we are close to that again. And as NAM, really with our close connections with the government, especially the House, that is when we see the customers that will come back. And I know that doesn't give the most palatable answer for right now, but that is really the approach that we specifically are able to take.
Thank you, Mark, for the challenge. It's very timely. As you're talking about customers, and I can see one of our main customers, one of our main influencers is actually the younger generation who are challenging us as the active researchers and the active workforce to do something about this. So I think increasingly, as our early career researchers come through their cycle, they'll be challenging us with their values and will be challenging funders and regulators on this as well. We are, I suppose, customers, again, we mapped the entire research process and realized there are so many unintended or unintended, unsighted impacts on the environment through healthcare research. And I think as you say, the policymakers are our main customers, and we should be able to move from transporting patients to large district general hospitals for clinical trials to work with the tech sector so we can run e-trials and wearables. And increasingly, that is what our population wants and expects. So I think we have to turn healthcare research and medicine slightly on its head. It is changing whether we like it or not, and we need to be ready to do this. You may have noticed on the working group, we did have building researchers, so people who actually create net zero buildings and can factor in the environmental impact of buildings, of high performance computings, and work to mitigate and reduce this risk. So we can actually lead by example. I did mention parliamentarians, but we can actually lead by example, and they can follow.
Thanks, Julia. Just a follow-up. The UK government, Julia? Oh, sorry,
Yeah,
Julia.
just building on the leading by example point, I think because of the role that we've had in this project, it's given us a platform to do much more in terms of that empowering teams to change. And I think Mark mentioned single-use plastics as a good example, and particularly where we're working with global commercial companies, pharmaceutical sector, for example, we're often under pressure to deliver protocols that have already been written for us. And actually, what we've been able to do as part of this project is come together and empower our teams to say, actually, we're not going to deliver the trial in that way. We need to make an amendment to the protocol. We will only receive the laboratory kits that we need. Our policy is to reduce our freezer temperatures and those sorts of things. And gradually, we will see a sort of swell of things being changed in that way. And we're starting to see it. So it's a bit of the top down and bottom up approach that I think this project's allowed us to support as well.
I also want to add that great questions, that we definitely have more work to do. US and UK collaboration, valuable precisely because we are similar enough to talk to each other, but different enough to challenge each other. For the government engagement, similar. So I think from UK, as you say, it's more top down, but US probably bottom up because UK has more centralized systems, has more signals from the top. But the US has much more fragmented systems and highly innovative landscape. So lots of engagement probably need to currently, especially, will be from the state level, it's not the federal, and then also from the bigger industries to do this. And there will be very interesting time ahead.
Yes. Mike.
Dr. Tufan from Turkey, I want to thank you all for sharing your experiences with us. I want to ask you a particular question about engaging the scientists, those deep divers, because for me, it's very challenging as a former bureaucrat and a diplomat and a scientist myself to engage those deep divers scientists to such kind of policy making projects. We need them because they know the basics, the details about some issues, but they don't want to join this kind of project. And it's very hard to create those platforms to engage them and make a bottom-up projects together with them. What's your experiences on that? I really wonder about it. Thank you.
Great question. Thank you. So I'll give kind of a high level perspective from NAM because communications is a pillar of one of the 5 pillars for our programs that this kind of falls under. Not specifically, it's all scientists in general that we really communicate with. And there's 2 approaches to think about. There is very much like this approach, the getting to speak in front of people who are able to or choose to come and hear you talk and hear you listen. Well, a lot of times that is those are people who are already are close to making the change and not as high of a number as we would like. So we have really pivoted, and this is in general for a lot of the communications with scientists that we do, not just specifically in climate health. Like we have really focused to the changing hearts and minds approach, and getting to them is a challenge. Like the pure amount of information that comes across everyone's eyeballs right now we haven't evolved to be able to handle it and to take it in. So we partner with the communications center at George Mason, and they really lay out a very simple and sound approach for us, which is simple and clear messaging from trusted messengers repeated over and over again is the way to change people's hearts and minds. And that if you get that message ingrained into enough people, hopefully they listen to you, but us up here are not going to change the hearts and minds of a lot of people. We're actually very reliant on the interpersonal relationships of scientists in order to have those conversations around the dinner table or at a coffee. Because like you said, people are already thinking about so much these days, and they have to not just hear it, they have to elevate it to that top 3 or 4 things that they're thinking about, because these changes are hard and they are challenging and you do have to push. So that has been really our approach, and not just specific, like I said, to this project, to this program, but in general, how we really look to tackle the challenge that you've laid out for us.
But I think on your question about engaging scientists in policy making, I think 2 things there. The Academy the National Academy, the US has made it over 50 years, more years, investment in trying to support and cultivate the ability of scientists to translate their knowledge into policy recommendations, but to amplify their voices and engage them in that way. But certainly the academic systems need to reward and provide incentive, right, for that, because the time of academics is so focused on their achievement in achieving tenure and climbing the ladder and publication, that there needs to be institutionally some way to reward that time that's spent engaging in policy.
Yes, I'd like to build on that as well. I think we find with early career researchers, they're coming into academia to do their PhD, for example, but they're not anticipating to stay in academic research or clinical research. We find now that they're coming in with a much wider expectation that they might work in biotech, or they might be an entrepreneur, or they might work in policy. And so I think at that early, even in a graduate program, we should be incorporating elements of entrepreneurial thinking and policy making as well, because these are the policy makers of the future. And I'd like to build on the National Academy of Medicine and say the Academy of Medical Sciences in the UK, working with the UK government, has created these programs. And Jenny and I are living examples of that, where they take researchers, future leaders, but train them in different aspects and understanding the academic environment, the industry environment, the policy environment, the clinical delivery environment, to enable us to be credible and pivot into those different sectors, to understand the drivers and motivations of those sectors. And so together we can bridge those gaps and co-create together. So I think we have to invest in training of scientists in a lot of adjacent skills to fulfill this potential.
Any other questions?
Sir.
So
Yeah, I
Tony,
just
do
want to piggyback a little bit more. So what we suggest is building sustainability into the existing system. For example, the grant review, promotion criteria, something like that. So developing simple and shared tool that's that researchers understand and the impact of a climate change doesn't need like PhD in carbon accounting on top of everything you guys are doing. So the point is, we don't require rewriting every rule overnight. So it's shifting. We want to change the system, but try to embed the changes into the existing systems to make the incremental changes.
Thanks, Tony. There are 2 questions at the back.
Okay, I'm Hasina Khan from the Bangladesh Academy of Sciences. The 2 things that I have in mind, which have already been alluded to, but it cannot be overemphasized. The first thing is the use of AI in medical science. There's so much of data that's being generated, and what's been said that there's this green AI technology, but how green is it? Can we really reduce the use of energy and water? There's so much data that's being generated each day. And in order to analyze those data, we know the kind of environmental, it's not sustainable at the moment. So that's something that needs to be addressed, and we don't know how it can be. And the other one is, I come from a country where so much use of single-use plastic, and we should really do something about using something else. And the last thing that I have in mind is we were talking about the policy customers. We know there are in Bangladesh, also in many countries, regional countries, they have this young generation who are ready to be those customers, taken the policy, but there's a strong disconnect between the government and science and in people in general. I think, I don't know how we can make our policy makers to take up the recommendations that has come out. Thank you.
So 3 questions, one first on AI, second on single-use plastic, and the last one, the disconnect between science and policy.
I've been nominated to take the AI one. So I think you're right. When there's a huge amount of electricity, but also water used in the high performance computing and AI. And when we're talking greener algorithms, I know that's not mitigating that risk. However, but I think we can as scientists sort of not use AI. Every Google search we do should not be AI generated, because that's using 10 times the amount of energy. So as research organizations, we can stop that from happening, and just you just get your normal Google search, not the ChatGPT version as well. The green algorithms is interesting, and that's a resource tool for the community that does the most efficient and effective algorithm possible for the question you want to ask. So, it's not a magic solution, but it's sort of acknowledging upfront that there is a cost to doing this research, and the cost benefit analysis, if we can reduce the environmental burden of that analysis, we have to do that. But this is increasingly the data being generated is just on a scale that hasn't ever happened before. And we've got to get better at compressing data, only storing one set of the data, and just stopping that exponential growth of data, and just keeping the valuable data, but not multiple copies and versions of it. But we don't have all those solutions yet. That might be phase 2.
So I just want to pick up your point about single-use plastics as an example, is that actually, although there are a lot of knowledge gaps in terms of the new things that we can research to help us achieve more environmental sustainability, so much of the evidence is already there. And it's about how do we implement it. And we found quite a lot that we've known for decades, but we still haven't managed to make some of those policy changes. And I think your point is really important. How do we move from generating the evidence to implementation? And we hope that through reports like this and others, and working in collaboration, we'll be able to really push that evidence further and harder in terms of some of those decision-making processes, rather than continuing to generate evidence that isn't going to have that impact. And then I think the point about the next generation and research leaders is that we really imagine an evolution of leadership where researchers and scientists are trained in this sphere, particularly around policy, to become leaders that will have that at the core of what they do, and they'll understand the settings. And I think that's, personally for us, that's been really important in taking into our leadership roles that understanding. And it's, I think, then how do we disseminate that in a wider sense to make sure that it's absolutely core to anybody who's going to be making decisions about health policy, for example, that they really have that grounding in being able to do that, and understanding that across a variety of sectors.
I don't have a solution for your big questions, but my higher level comment is that try to bring in community and patients' voice in this area. So the more people talking about this, the more likelihood to trigger changes. And also try to deepen the econ or business case for this kind of issues, AI, plastics, science policy related work. So quantify them, talk about the dollars, make people realize that makes sense. So that could potentially make some shift. Thanks.
I'll speak for a quick sec because a lot has been shared on AI, but I think I'll kind of just wrap it up in sharing that, like, we don't know the path that we're on for this AI technology. We know that there's millions of paths laid out in front of us, and which one we go down, I think, is still to be determined. But what I do know, and what we are really trying to push, is that scientists, and especially scientists in the health field, have to be at the table for these conversations. Like, we have to continue to push and push and push, because there is like an inevitability about the fact, and I think especially from a US centric perspective, that there are people with different priorities, and trying to think of a word that's not perverse, but very, very free market driven priorities that are going to continue to push what they want from this technology, and we have to be there to counteract that as much as we can. The last question that you raised about the alignment of the science and evidence and policy, what we have tried to do is approach, and it's kind of what Tony said, is really try to align incentives. So figuring out from policymakers, like, what do they want to achieve, and especially those who are nominated and elected into office, like, what does their constituency want, and really trying to bridge that gap for them. So to say, if you are to take along X policy that is going to bring about this betterment of health in your community, here's what it will bring you in terms of your election results, or the kind of shift in the narrative that you're trying to control. So very much aligned with what Tony said, so aligning the incentives. So figuring out really what these policymakers want, and then figuring out how your evidence, supports in an ethical way them to bridge that gap, so you both are able to achieve.
Thank you. So, question from a gentleman at the back.
Thank you very much. My name is Ephraim Kayembe from Malawi. I wanted first of all to commend the presenters. I think it's a detailed presentation. My interest, it's twofold. The first one is in terms of the initial challenges that the researchers faced, especially from the two academies, when they were coming up together and developing that particular kind of research project. How did they iron out the challenges at the initial stage so that they could complete the whole research? That's the first issue. The second issue is about the actual dissemination of policy recommendations that you have developed and suggested. Have you engaged the government officials and the funders, and what has been the general response? More especially when we are seeing that the investment in health research is actually a little bit dwindling globally, but yet this is the right time for us to sort out certain issues that are directly impacting the communities vis-a-vis health impact on the climate change situation. I submit. Thank you.
Okay. So, two questions. One, how did you start, and where are you going next? Oh, sorry.
So I just comment on how did we start, because for me that was one of the most fascinating parts of the process, and really why it was so important that we had the support from the two academies, actually, because when a group of passionate, motivated researchers got into a room, and the first time we met physically was in London, we had so many ideas. It was actually really difficult to distill, and I think we went through several iterations, didn't we? And I think what was really important was that we identified a sort of North Star, as we called it, quite early on, and kept coming back to it and saying, how does this meet our core mission? And particularly around that was the equity value. How does everything that we do address this question of health equity? And that was really important. But I think it was extremely challenging, because we kept going off in different directions and having to come back. And I think that's why having the guidance from the UK and US context really helped us to form that idea. But it took quite a long time. I think probably 50% of the project was really defining it, rather than actually the writing it and bringing it together was sort of easier in a way, I think.
Dissemination?
Oh, so for the where are we going, I think you're seeing it today. It's a work in progress, and we are having this conversation as part of that to figure out what types of next steps might be.
Anyone else want to add to it?
I would certainly like to see academies use their convening power to host follow-up workshops and use the different multiple channels like short policy briefs, webinars, others events to make this more fully disseminated.
If I go back to the how did we do it, I would say initially that, as Jenny described, the how we did it was a lot of ideas and a lot of passion and a lot of pet projects, and one of the first lessons one needs to learn in sort of distilling evidence for policy making is that essence of co-creation, collaboration, and compromise. So you may not get everything that you want in those policy recommendations, but the totality of the sum of the parts is for the greater good. And that was, again, a great learning experience for that group of researchers that we brought together.
Thank you very much. I think we are coming to a close of this session. So before I close, I would like to first thank all of the panelists and Chris for your time and sharing your experiences. Huge thanks to staff at both the academies, the Academy of Medical Sciences in UK and the US's National Academy of Medicine, particularly Annabelle Miller from AMS UK, who's here, who's been the driving force from the UK end, and Chris from the US end. Also thanks to the staff who are with us today, Liz Baum and Laura Schaffler from the AMS. So we are around, so if you have any questions, please grab us during lunchtime, coffee break, or in the evening if you have any questions or things that you are working, you want to hear more about from you on what you're working in your academies, in your countries, in climate and health care research, but also overall climate and impact on health. So really keen to explore opportunities for working further and taking this to the next step. Thanks to the audience who joined us online. There were 2 questions on AI and implementation, which I think the panel has already answered. So thank you for your interest. And thank you all for joining, and wish you the very best for the next few days. Thank you.